according to nursing education. Advantages of demonstration method according to nursing education. Advantages of advantages of demonstration method according to nursing education. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. আস্তাগফিরুল্লাহ রাব্বি মিন কুল্লি যামবি ওয়া আতুবু ইলাইহি। আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হে আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Advantages of demonstration method in nursing education. The demonstration method is a teaching method in which the teacher shows a procedure, skill, or technique while learner observe and then practice it. It is widely used in nursing education for teaching clinical skills. Advantage: enhances learning retention because students learn by seeing and doing, promotes active participation when followed by written demonstration, reduce errors and misconceptions by showing the correct technique, builds confidence in performing nursing procedures, encourages critical observation and attention to detail, suitable for large and small groups of learners, ensures uniformity in teaching clinical procedures, increases student interests and motivation through visual learning, provides immediate feedback and correction from the instructor, improve patient safety by teaching standardized nursing practices, useful for teaching complex procedures step by step, facilitates competency-based learning and skill assessment. Conclusion: the demonstration method is one of the most effective teaching methods in nursing education because it helps students acquire clinical knowledge, skills, confidence, and competency through observation and practice. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah Rabbi min kulli dhanbi wa atubu ilayh. আয় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। Disadvantages of demonstration method according to nursing education. Disadvantages of demonstration method according to nursing education. Disadvantages advantages of demonstration method according to nursing disadvantages of demonstration method according to nursing education. Disadvantages of demonstration method in nursing education: time consuming. Demonstrate requires considerable time for preparation, presentation, and practice. requires skilled teachers. Effective demonstration method depends on instructors' expertise, communication skills, and clinical competence. Limited participation in large groups. Not all students can actively participate or observe clearly. When the class size is large, need for adequate resources, equipment supplies, models, and clinical settings are necessary, which may not always be available. Costly method procuring, maintaining, teaching materials and equipment can be expensive. Individual differences are overlooked. Students learn at different speeds, but demonstration often proceeds at a fixed pace. Passive learning tendency. Some students may become mere observers rather than active learners. Difficult to demonstrate all procedures. Certain complex, rare, or hazardous procedures cannot be easily demonstrated. Visible problems. Students at the back may not see the procedures early. Limited retention without practice. Students may forget the demonstrated skill if they do not perform written demonstration and repeated practice. Conclusion. Although the demonstration method is highly effective for teaching psychomotor skills in nursing, its effectiveness may be limited by time, cost, resources requirements, and insufficient students' participation if not properly planned and followed by supervised practice. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah Rabbi min kulli dhanbin wa atubu ilayh। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসান আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় আপনি সফলতা দান করুন। Taxonomy of educational objectives. Taxonomy of educational objectives according to nursing education. According to nursing education. Taxonomy of educational objectives according to nursing education. Taxonomy of educational objectives according to nursing education. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam astaghfirullah rabbi min kulli dhanbin wa atubu ilayh। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করার সফলতা দান করুন। In nursing education, the taxonomy of educational objectives is mainly based on Bloom's taxonomy, which classifies learning into three domains: cognitive, affective, and psychomotor. It helps nursing educators design learning objectives, teaching plans, and evaluation methods systematically. Cognitive domain knowledge or thinking focuses on intellectual abilities and critical thinking levels. Simple to complex knowledge recall facts, example define blood pressure, comprehension, understanding, meaning, example explain hypertension, application use knowledge in practice, example measure BP correctly, analysis break down information, example differentiate types of shock, synthesis combines idea, example plan nursing care, evaluation judge effectiveness, example evaluate patient outcomes, nursing example interpreting ECG results or or planning care based on assessment, affective domain, attitudes or feelings, focuses on emotions, values, and professional behavior levels, receiving awareness, listen to patient's concerns, responding, participation, answer patient questions, valuing shows commitment, respect, patient dignity, organization integrates values, prioritization, ethical care, catheterization, consist behavior, demonstrate professionalism always, nursing example showing empathy, ethical practice, patient respect, psychomotor domain skills or doing, focuses on physical and clinical skills levels, perception uses senses, observations, patient condition, set readiness to act, prepares equipment, guidelines, responses, imitates procedures, dressing under supervision mechanism, performs with confidence, administering injections, complex overt response, skilled performance, IV insertion efficiently, adaptation, modifies skill, adjusts technique in difficult cases, origination, creates new methods, develops improved procedure, nursing example, catheterization, wound dressing, injection administration, summary, Bloom's taxonomy in nursing education ensures structured learning from basic to advanced, balanced development of knowledge, attitudes, and skills, effective patient care through competent nurses. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah rabbi min kulli dhanbin wa atubu ilayh. Level of cognitive domain. Level of cognitive domain according to nursing education. A level of cognitive domain according to nursing education. In nursing education, the cognitive domain refers to intellectual abilities such as thinking, understanding, reasoning, and problem solving. It is commonly based on Bloom's taxonomy levels of cognitive domain. Bloom's taxonomy knowledge or remembering, recall or recognize facts, terms, and basic concepts, keywords, define list, state, name, nursing example, list the sign of hypoglycemia, comprehension or understanding, explain the meaning and interpret information, keywords, describe, explain, summarize, nursing example, explain the purpose of hand hygiene, application use knowledge in new or clinical situations, keywords, apply, demonstrate, use, nursing example, apply sterile technique during dressing change, analysis, break information into parts and examine relationships, keyword, analyze, differentiate, compare, nursing example, differentiate between viral and bacterial infection symptoms, synthesis or creating, in revised taxonomy creating combines ideas to form a new whole or plan, keyword, design, develop, formulate, nursing example, develop a nursing care plan for a post-operative patient, evaluation, make judgment based on criteria and evidence, keywords, evaluate, justify, critique, nursing example, evaluate the effectiveness of a pain management plan. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah rabbi min kulli dhanbi wa atubu ilayh. হ্যাঁ আল্লাহ দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ইমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে ধরনের পরীক্ষায় পাশ করায় দেন। অ্যাসেসমেন্ট অ্যাকর্ডিং টু নার্সিং এডুকেশন। Assessment according to nursing education. لا إله إلا الله محمد رسول الله صلى الله عليه وسلم استغفر الله ربي من كل ذنب وأتوب إليه. হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে আপনার খুশির উদ্দেশ্যে আপনার খুশি অনুযায়ী ঈমান আনা এবং আমল করার তৌফিক দান করুন। হায় আল্লাহ, দয়া করে সকল জিন এবং ইনসানকে সকল ধরনের পরীক্ষায় পাশ করায় দেন। In nursing education, assessment refers to the systematic process of collecting, reviewing, and interpreting information about a learner's knowledge, skills, attitudes, and clinical performance to determine the extent of learning and competency achievement. Definition of nursing education context: assessment is the continuous and planned process used to measure student learning outcomes and clinical competence against defined educational objectives in nursing programs. Purposes of assessment: determines learners' cognitive, psychomotor, and affective domain achievement, evaluate readiness of clinical practice and patient care, identify strengths and learning gaps, provide feedback for improvement, guide teaching strategies and curriculum modification, ensure professional competency and patient safety. Types of assessment: diagnostic assessment conducted before teaching, identifies prior knowledge and learning needs. Example: entry test before starting a nursing module. Formative assessment: ongoing doing teaching learning process, focus on feedback and improvement. Example: quizzes, bedside observation, skill demonstration. Summative assessment conducted at the end of a course or unit, measures overall achievement. Example: final exam, OSCE. Clinical evaluation. Domains assessed in nursing education: cognitive domain, knowledge, understanding, critical thinking; psychomotor domain, clinical skills, procedures; affective domain, attitude, professionalism, communication. Methods of assessment in nursing: written examination, short answers, essay; objective structured clinical examination or scheme; clinical performance evaluation, bibliography, oral examination, checklist and rating skills, case studies and assignment. Importance in nursing education: ensure safe and competent nursing practice, maintains quality of education and training standards, support evidence-based nursing decision, promotes accountability in healthcare education, helps produce skilled patient-centered nurses. La ilaha illallah Muhammadur Rasulullah sallallahu alaihi wasallam. Astaghfirullah. Rabbi min kulli dhanbi wa atubu